If your baby has been waking up in the morning or after they sleep with their eyes completely clogged shut, or it seems like they're tearing up throughout the whole day, they may have a blocked tear duct. So in today's video, I'm going to share with you a simple technique you can try at home and safely open up the tear duct so the tears can start to flow down easily and this clogs and tearing can start to disappear. So blocked tear ducts are common. About 5% of babies have their tear ducts blocked by the time they are born, but most of them are harmless and tend to disappear by the time they turn between 1 year or 15 months of age. So naturally, when a tear glands of our eyes make tears, it runs through the eyes, through the duct system and drains into the nose. For some babies, this does not function normally because the tear duct at the end is blocked either by a tissue or a membrane, and that narrows that duct. So what happens is the tears kind of pull and back up, and they constantly keep draining because it's not draining up to the nose. And then they may now pull along the side of the eye and constantly have them discharge the crustiness they get when they wake up in the morning. So here's how you can help them. First, if they have any active discharges, any crustiness is currently there, you want to wipe it off. So you want to grab a soft cloth, clean cloth, or like cotton balls and soak it in warm water and clean from inside out. We always recommend cleaning from inside out for even any infections because you're trying to reduce the risk of introducing any bugs towards the tear duct system. So you clean this out from inside out. Of course, you always want to make sure you're washing your hands before and after cleaning out the discharge and before the massage. And for the massage, it's called Crigler massage, and the idea is to be able to put enough pressure to open up these tear ducts and help them drain. So this is not a rolling motion. So you want to put your hands here close enough to where the tear ducts are, and then you want to press and drain down so you can put enough pressure to open it and let it drain. And you want to repeat this massage 3 to 5 times each time you're doing it, and then 3 to 4 times a day, because the idea is to be able to open that duct so the tears start to flow normally. Most babies with blocked tear duct actually resolve when you constantly do these massages. The tear duct tends to open and they need no other intervention. But some babies who continue to have this frequent tearing or clogginess every time they wake up in the morning may need to be seen by the eye doctors if this persists beyond 1 year, maybe going towards 15 and 18 months of age. While you're doing this massages at home and observing to make sure your child grows out of their blocked tear duct, here's some red flags you always want to watch for to make sure you're getting care immediately. If they develop redness of the conjunctiva, which is inside the eye, which is concerning for an infection or conjunctivitis, if you're noticing a generalized swelling around the whole eyes, which is affected, we always get concerned about that. Or maybe you're noticing a bump and then redness around just very close to where the duct is, and you're noticing redness and swelling there. This we get concerned about something called cystitis, which is a serious infection of the tear gland and the tear duct that needs to be evaluated. So blocked tear duct typically happens only in one eye versus the other, but if you're noticing the other eye starts to get red and swollen as well, you also want to get that evaluated. Or you can also get them checked for anything else you're concerned about, in addition to the blocked tear duct and the eye symptoms getting worse. I know these eye discharges can be scary, especially in babies that are young, trying to figure out what's going on with them, but majority of them are blocked tear duct. I hope this video has been helpful for you to know exactly where and how to perform the Crigler massage to be able to open that duct and your child's tear glands as well, your child's tears to start flowing normally. If your baby is experiencing this now, or your baby has experienced this before, please feel free to share in the comments, as this is going to be helpful for other new parents who come across this video. Don't forget to subscribe, and I will see you in the next video.